Hi guys, welcome back to the channel. So little information, next week is Holi, so I'll be uploading only 2 videos. Play safe Holi, be safe guys. And yes, so let's start today's class. So last class we have done with the histology, histopathology of the nasal squamous cell carcinoma, okay? Like in general histopath में क्या दिखता है हम लोग को squamous cell carcinoma में. Now today we'll be starting the squamous cell carcinoma of lips. So it occur more frequently on the lower lip than the upper lip. Account for 20 to 25% of oral squamous cell carcinoma. So both the lip including account for 20 to 25% of oral squamous cell carcinoma. Though upper lip carcinoma behave more aggressively, though they are less common, but they behave more aggressively. Lower lip carcinoma have two general presentation. First is an exophytic growth, which is slow growing mass, which is more common. And second is eroding and destructing invasive अल्सरेशन. तो दो तरह का लोअर लिप में भी दिखता है. पहला एक्सोफाइटिक जो स्लो ग्रोइंग मास होगा and this is more common, and second is eroding and destructing invasive ulceration. So the first one, that is exophytic slow growing growth, is generally related to sun exposure. It is mainly related to sun exposure. तो etiology of exophytic growth in lower lip carcinoma is mainly sun exposure or UV light, and occurs on the paramidline lip part of the lower lip. So it mainly occurs on the paramidline lip out of the lower lip. It behaves like cutaneous squamous cell carcinoma by its slow growth and minimal metastatic potential. So this exophytic type of lower lip carcinoma, it behaves like a cutaneous squamous cell carcinoma क्योंकि इसका growth pattern भी slow है and the metastatic potential is very minimal. The specific carcinogen portion of UV light is thought to be UVB light is a more complete carcinogen. So UV light में भी अलग अलग पोर्शन होता है, UVA, UVB अकॉर्डिंग टू द स्पेक्ट्रम. ठीक है, इतना वेवलेंथ है या जो भी है उसके वेवलेंथ के अकॉर्डिंग स्पेक्ट्रम जो भी बोले उसके अकॉर्डिंग उसका भी कैटेगरी होता है, UVA, UVB लाइक दैट. सो UVB इज मोर कंप्लीट कार्सिनोजन एंड इट इज थॉट टू बी द स्पेसिफिक कार्सिनोजन फॉर लोअर लिप एक्सोफाइटिक ग्रोथ. ओके, नाउ the erosive and infiltrative carcinoma of lower lip and including those of upper lip seem to be more related to cigarette smoking. So the main etiology for upper lip and the eroding and destructive type of lower lip carcinoma, the main etiology is cigarette smoking, and tend to occur more on labial mucosal surface of the lip, and it occurs mainly on the labial mucosal surface of the lip. Now in these, the oncogene expression is more like traditional mucosal cell carcinoma. So जो लोअर लिप का एक्सोफाइटिक ग्रोथ था वो क्यूटेनियस स्क्वामस सेल कार्सिनोमा जैसे बिहेव कर रहा था, लेकिन अपर लिप और लोअर लिप का जो इन्वेजिव टाइप है इट बिहेव्स लाइक अ ट्रेडिशनल म्यूकोजल सेल कार्सिनोमा, क्योंकि विद इट्स ग्रेटर इन्वेजिव पोटेंशियल एंड प्रोपेनिसिटी फॉर लिम्फ नोड मेटास्टेसिस, क्योंकि इसका इन्वेजिव पोटेंशियल भी ज़्यादा होता है और लिम्फ नोड मेटास्टेसिस होता है. सो इट बिहेव्स मोर लाइक ट्रेडिशनल म्यूकोजल स्क्वामस सेल कार्सिनोमा. नाउ कमिंग टू डिफरेंशियल डायग्नोसिस, जो एक्सोफाइटिक लोअर लिप कैंसर है वो दिखते हैं मेनली कैन हैव अ डिफरेंशियल डायग्नोसिस ऑफ केराटोएकेंथोमा, salivary gland tumor mainly mucoepidermoid one, then inflammatory condition like infected trauma or traumatic eosinophilic granuloma. So these are the differential diagnosis for exophytic lower lip cancer. And for invasive one, all these are the differential diagnosis like salivary gland tumor, inflammatory condition, except keratoacanthoma. Keratoacanthoma is the only differential diagnosis for exophytic lower lip cancer. So, except keratoacanthoma, all differential diagnoses are same for erosive type. Okay, that's all for today. We'll be meeting next week. Till then, like, share, subscribe, and comment.